Hi, my name is Alicia Carranza. I'm a health educator with the county's Tobacco Use Prevention Program, and I'm going to share some information with you in this training about how you can support your clients with quitting smoking and vaping. Today, we're going to talk about the EHR update, why it's important, and free resources that are available to support your clients through the Tobacco Use Prevention Program and New Lung, the county's cessation provider. As many of you might know, at the end of last year, the electronic health records were updated to include both the local and state quit lines, new lung and no butts, when prompted on the screen to screen clients for tobacco use. This will hopefully make it easier to refer clients to services so they can receive free support and tools to help them quit smoking and vaping. This applies to both mental health and substance use disorder programs. So why is this update important? With the current pandemic, individuals who smoke are increasingly vulnerable to contracting COVID-19. And although we're emerging from the pandemic, smoking does weaken the immune system and doubles the risk of other respiratory infections as well. It doubles the risk for suffering more severe symptoms from COVID-19 if it is contracted. This is a good time to quit. So why else do you think this update is important? Screening clients for tobacco use and referring them to support and tools is important for a few other reasons, including that this population has a higher prevalence, with 1 in 3 adults with a mental illness using cigarettes compared to 1 in 5 adults without. This is partially due to the marketing tactics of the tobacco industry, which targeted this population. You can learn more about that in the toolkit on page 5. These individuals are also more nicotine dependent, which can make it more challenging to quit. Individuals with higher dependency may need additional supports with quitting, such as the use of combination nicotine replacement therapy, which I will talk about a little more detail later this training. And lastly, they are more likely to die from tobacco use than their mental illness or substance use. The 3 leading causes of death among individuals with behavioral health disorders is heart disease, cancer, and lung disease. All of these can be developed from tobacco use. So although it may be more challenging for individuals with behavioral health concerns to quit, they're just as interested in quitting as anyone else that smokes, and they benefit from the same evidence-based smoking cessation treatments. Both the local New Lung program and the state California Smokers Helpline use evidence-based smoking cessation interventions. To refer clients to the local quit line in Orange County, you can refer them to 866 New Lung or 866-639-5864. In addition to the phone number, there are a few other easy ways that you can refer clients to cessation services. New Lung has a website, 1-866-newlung.com, that has a link to sign up for services. If you have time, you can fill it out during appointments with the client, and a tobacco cessation specialist will contact them within 2 business days. Also, the time you spend with clients connecting them is a billable service. I'll talk a little more about that later on. Another option is to complete a tobacco cessation referral form and email it to Nang at the email address listed in the PowerPoint. That information will also be included in the toolkit that you should have already received. Direct referrals such as this can help clients to take action at the time they are most motivated to quit. This referral form is included in the toolkit on page 18, and it is also available online on the New Lung webpage. When clients enroll in services through New Lung, they will receive one-on-one virtual or telephone counseling, free nicotine patches, coupons for other NRTs like gum and lozenges, and a quit kit. The California Smokers Helpline also offers free services by phone, text, and mobile apps. Nicotine patches are also available, Information on the California Smokers Helpline and additional tools such as text-based services will be included in the toolkit. I do want to bring your attention to the transition for new no butts. So as of September of this year, they will be transitioning to rebrand themselves as Kick It California. Between now and September of 2021, please continue to use the No Butts line, No Vape, as well as the California Smokers NoButts.org webpage. From September forward, please use the Kick It California webpage as well as their new phone number, 800-300-8086. All of that information will be contained in the toolkit as well to help you when this transition occurs in September. So now I'm going to go ahead and share a little bit of information about the new toolkit that the Tobacco Use Prevention Program has developed. So one of the first sections is about how to engage clients around tobacco cessation. We have some information about the Ask, Advise, and Refer model, which is a quick, easy way to screen and refer clients to tobacco cessation services. There are also sample questions to help you consider ways to approach the topic with clients and information about how to refer them, what I included in our training today, as well as additional referral options. The California Smokers Helpline does have an option available to integrate referrals from the EHR directly to them. And so if your program or clinic is interested in learning more about that, you can actually look at the toolkit for more details. So in addition to getting behavioral health support for quitting, nicotine replacement therapy is another important tool that increases the chances of successfully quitting. It helps fight cravings and reduce withdrawal symptoms, which can lead to relapse. In the toolkit, you will find information on how to help clients get connected to free nicotine replacement therapy. Free nicotine patches are available through New Lung and the California Smokers Helpline. And any Medi-Cal member can get any of the 7 quit smoking aids that are approved by the FDA for free if they're given a prescription. More information about that, again, is contained in the toolkit. Any prescribing clinician can provide that prescription to the client, whether it's a psychiatrist, primary care physician, or even a pharmacist. So in addition to supporting your clients in quitting, we want to support you with the time that you're spending to help your clients with this. Medi-Cal does recognize the valuable service that you're providing by providing billing codes for tobacco cessation counseling. Counseling can be as little as 3 minutes or as long as 10 minutes, and information about the CPT codes, ICD-10 diagnostic codes, and other documentation requirements in order to bill for this service are all in the toolkit. So now I'm going to walk you through some of the resources that we have available. 866newlung.com has a wealth of resources that you can access both with clients and after appointments. So to sign up for services, there's a couple different ways. You can go ahead and click here, sign up to quit. There's also an option up here, as well as just clicking contact. When clients open this, they'll be able to see some information about what the services entail, and then they'll be able to go ahead and sign up and provide their information for a cessation specialist to reach out to them. If you're interested in getting any free materials to put in your lobby waiting area or your office, you can click on free materials here. And there's things like our quit smoking brochure, waiting room puzzles, which are really good for clients that are trying to quit smoking. It helps with that physical part of the addiction, as well as that referral form that you can email off to Nang at New Lung if you're interested in sending a client off to New Lung services. That same referral form will be in the toolkit as well. You can also request hard copies of these materials if you're not able to print them by clicking contact. By clicking contact us here. Here you can enter your information and you can have New Lung send you whatever resources that you're needing. Print brochures, New Lung quick cards. They can even provide free podcast CDs that they have available. And so for clients that might be interested in quitting but are a little hesitant, you can even refer them to listen to that podcast. And they can either use the CD or it is available online on the website. So under resources and podcast, we do have the 5-session series available, as well as 2 additional podcasts that give a bit of an overview about what New Lung services are. And if you're interested in learning more about New Lung, you can actually go to resources and newsletter, and you can actually subscribe to receive their quarterly newsletter. It'll have tips on how to continue working with clients, any new resources that are available, as well as any events that New Lung may be attending. They have their previous newsletters available online as well. In addition to accessing those free materials, you can also contact the Tobacco Use Prevention Program for other free hard copy materials, including educational brochures, flyers, and other materials. In the toolkit, you'll see an order form that gives you a list of some of the information that TEP has available to share with you. If there's any specific information that you're needing, please feel free to reach out to us and we can do our best to find the specific resource that you're looking for. In addition to the information I just shared, the toolkit also contains things like how you can host virtual quit smoking services at your clinic. If you have at least 5 participants that are interested in quitting, New Lung can arrange to have cessation services offered for your program virtually or in person if it is available, depending on the COVID-19 pandemic. We also have information about how to cope with stress. We understand that stress is a trigger, a very large trigger for individuals when it comes to relapse. And so we do have information about the brochures we have on stress management, as well as information that New Lung's program does contain stress management within their curriculum. There are also text-based services available. So the smoke-free text has services for very specific populations, such as veterans. So if you're working with any of those particular groups, it may be helpful to refer them to text-based services. They can use that in addition to New Lung or the No Butts Quit lines to provide them some support after hours when they might not be able to reach their cessation specialist. There's also a 10-step guide on how to become a smoke-free facility. Being a smoke-free facility can help support your clients' quit attempts by removing the environmental trigger and a lot of the social aspect around smoking. If your clinic is interested and you're needing more information, please feel free to reach out to us and we can help you through that process and connect you to the appropriate resources. And finally, we wanted to include some trainings. So the Tobacco Use Prevention Program will be continuing to offer trainings throughout the rest of this year. But we also wanted to provide some trainings that you're able to take at your own pace and your own time. So there are different trainings available that help you better understand the connection between tobacco use and behavioral health, different ways to engage clients around cessation, as well as working with different populations. Some of these trainings also offer free continuing education units for different providers, including KDAC, nurse practitioners, psychiatrists, LMFTs, LCSWs, and more. So in 7 words or less, if you have any other tobacco-related topics that you're interested in learning more about, please go ahead and scan the QR code and go ahead and type what topics you would like us to train on.